We are pleased to have Chris Buresh here for the 2019 Outstanding Alumni Award recipient. Chris, I'd like to ask you a couple questions.
Sure.
So the first question is, I just want to know what it feels like to win this award.
Yeah, it's pretty stunning, actually. I've been aware of a lot of the work that happens here at the College of Public Health, and know a lot of alumni and have seen a lot of the work that other alumni do. And so to be nominated for this award was really tremendous, but to win it is really incredibly humbling. I think, there's so many great people out there doing so much amazing stuff that I'm, it's hard to really put it into words.
Yeah.
But it's fantastic.
Great. And you received your MD degree here from the University of Iowa, and then a number of years later you decided to come back for your master's in public health. What motivated you to come back and further your education?
Yeah, so as I was doing some work in the emergency room and also internationally, I realized that so much of what I need to know is beyond the scope of what you learn in medical school. I learned that when you look at the health of a group of people or a population, only about 10% of what determines whether that population is healthy or not depends on access to good medical care. And so I felt like there was this whole other 90% that I didn't know anything about and
Right.
wasn't doing anything to address. And so, I think both internationally, but also domestically, if you want to really advocate for change and help people out, you have to understand the rest of the picture. And so the College of Public Health was amazing in giving me that perspective and helping me learn about ways that I can just really help speak for my patients more intelligently.
Great. And you touched on this a little bit, but how has your public health training really helped you treat your patients in the emergency department?
Yeah, I think the two ways that they really intersect are that one, that emergency medicine and public health are a lot alike in that they're both really team sports.
Mm-hmm.
Right? You have to interact with people, or you get to interact with people from all different sorts of backgrounds, with all different sorts of specialized knowledge, and you can learn something from each of them, which I love. I think that's tremendous. In other ways, they're really different in that when I see somebody in the emergency department, it's usually, I'm kind of, it's the final common pathway of some really upstream causes that we potentially could have addressed, right? So whether that's access to good food or nutrition, or, gun control, or, exercise, or, environmental health.
Right.
Usually a lot of what I see in the emergency room is a consequence of that.
Mm-hmm.
And so it's nice to be able to understand sort of the whole spectrum of health and disease, and be able to understand the points where you can intervene.
Great. And then my last question for you is, what advice would you give to students that are studying public health right now?
Right. I think I would say enjoy it, really. I mean, there's certainly times when I was in school that I remember thinking, gosh, I don't know if what I'm learning right now is going to apply all that well to what comes later.
Mm-hmm.
But the truth is, you don't really know what comes later, right? I certainly never thought I'd end up where I am now. And there have been a lot of times where, looking back, I think, oh man, I wish I would have paid attention a little bit more to this, that, or the other, because it sure would come in handy right now.
Mm-hmm.
The other thing I would say is that the education here is top notch. And it is really a privilege to have access to that and to be given sort of the tools to build an incredible career and really make a difference in the health of people you care about. And so I think I would say, don't take anything for granted and just be grateful and enjoy it, because it is a pretty fantastic opportunity.
Well, that's great. Great advice. And thank you again, and congratulations.
Thank you.